With inflation on the rise, many Americans are looking to cut costs whenever possible, including for medical care. We're here to discuss strategies to save on healthcare costs and reduce the risk of a surprise medical bill is Dr. Donna O'Shea, Chief Medical Officer at Population Health for United Healthcare. Dr. O'Shea, thank you so much for joining me. This is such an important topic of ways we can save and cut costs on our medical care for sure. So what are surprise medical bills and how big of an issue are they?
Yeah, well, thanks for having me. And you are right that surprise medical bills have been a significant issue. And now more than half of Americans are experiencing this at some point. Fortunately, recent federal regulations, including the No Surprise Act, are helping reduce the likelihood of people receiving an unexpected medical bill. Now, these surprise medical bills most often occur when an out-of-network healthcare professional is involved in your care, which can trigger this outsized bill. Now, out-of-network care providers or facilities don't have a contract with your health insurance plan and can often charge many times more for services compared to what you would pay for an in-network professional. So it's important for people to always start with an in-network healthcare professional and facility for non-emergency care, including when you're referred by your primary care physician to labs for blood work, MRIs, or other tests.
Okay, that's good to know. So then how can people avoid going to an out-of-network care provider?
Well, the best place to start is by checking with your health plan, which can provide you with a list of your in-network care providers and facilities, along with quality and cost information. For instance, at United Healthcare, members have access to this type of information online via a mobile app and by calling the number on their ID card. And it's also a good idea to confirm with your health plan that services or tests you may need are covered under your benefits. And you can work with your healthcare provider to complete a pre-authorization form in advance of any care.
What do people need to know when they're price comparison shopping?
Oh, besides the No Surprises Act, other recent regulations have required hospitals to post prices online with more consumer-friendly disclosures scheduled to take effect in 2023. In the meantime, United Healthcare provides members with quality and cost transparency resources for more than 800 common medical practices, including personalized estimates based on actual contracted rates. Now, if your health plan doesn't offer that information, you can also find publicly available transparency resources online. You can ask your doctor or support staff how much the service will cost, or you can call around to other local healthcare providers to ask about pricing.
If someone does have this surprise medical bill show up, what do they do then?
Well, there's a couple of steps that you should take if this happens. First, try talking with the support staff at the hospital or doctor's office to request having the charge waived or reduced. If needed, some health plans offer access to resolution support to help negotiate on your behalf. And if you receive a surprise bill from an out-of-network care provider, do not immediately pay the bill. Call the number on the back of your insurance ID card to alert your health plan and check for assistance.
And then, Dr. O'Shea, what can you tell us about new health plans that offer clear upfront pricing before people schedule medical appointments?
Well, to help simplify how people access healthcare, there are new health plans to look for that eliminate deductibles and offer clear upfront pricing information before you schedule your medical appointment or receive care. For instance, United Healthcare recently introduced Surest, and that's a health plan that uses data-driven recommendations to help you make more informed decisions about when and where to access care. And as a result, these Surest members paid 44% less out of pocket as compared to some traditional plans, and helped reduce that chance of a surprise bill showing up weeks or months after a service or procedure.
If people want more information on this, where can they go for that?
Well, you can, for more information on how you can save on healthcare costs and reduce the risk of a surprise medical bill, you can go to uhc.com and find out more.